morning. Thanks for watching Living Local. Today, Charles and I are headed back up to AIM Acupuncture and Integrative Medicine up in North Myrtle Beach, one of our favorite places to visit and meet all the patients and hear their stories. Today, we're going to be chatting with Dr. Weber about one of her new patients just starting out, Mr. Horst. So I'm here with Dr. Weber, and so basically we are following Mr. Horst through his journey. He has neuropathy, right?
Yes, and he's given us permission to talk about him.
Okay,
And
what did he kind of come in for? What was he experiencing?
foot pain and lack of sensation in the feet is a bit of both. The first stages is pain. You feel burning or tingling or sharp pains, or you feel like you're walking on tacks or marbles.
Gosh, that's painful.
Then it typically progresses to people say they feel like they have paint on the bottom of their feet.
Really?
Like they can feel something, but there's a distance. Think about when you go to the dentist and you get numbed and you can feel stuff, but it feels like it's far away.
Right.
So people have that sensation on their feet, but the pain eventually subsides. And you would think that'd be a good thing.
Right.
That's a bad thing.
Because then you're numb.
Because you're numb. The numbness brings with it a whole other host of problems.
So going back with Mr. Horst and kind of his journey, you know, what is kind of the plan for him? How long is he expected to kind of do it?
So he's a very typical neuropathy patient. And what we find the best results is a 3-month program. So 3 times a week for the first month, twice a week for the second month, once a week for the third month. That's what we're looking at.
Okay.
And that's our intensive program. And at the end of that, the majority of our patients have gotten about 75% improvement. I mean, people have had something for 10, 15, this has been building for 20 years.
Yeah.
It's not going to, 3 months is a bargain.
Right. After about a month and a half of treatment, we decided to catch up with Mr. Horst himself and see how his treatment's going. Take a look. So tell me, you know, how are you feeling? Have you noticed any changes?
Absolutely.
Really?
Yeah.
No way. Well, tell me how you feel. What's different?
I mean, the feeling's getting back.
Yeah?
You know, I would say about 40%.
40%?
better right now.
That's amazing, though,
Yeah,
to have
yeah.
any kind of change.
Right.
I know when we talked to you last, you were saying, this is the last option for me. This is the last
option.
thing. Because you've tried multiple things before, right?
Right.
Nothing helped.
Nothing helped.
So
No.
is it safe to say this is the first thing that's done anything for
The
you?
first thing that I can say, it's better.
That's so exciting.
Yeah.
So when you say, you know, it's gone up 40%, what exactly are you feeling that you didn't feel
I
before?
got feelings right now in my legs when I'm walking.
You had a hard time diagnosing this, right? Did they know what it was right off the bat?
No.
No, because you had all those horrible nerve tests, right?
I had nerve tests, I had heart tests. I mean, I went to 13 doctors. Everybody here in Myrtle Beach. I went to 2 doctors in Charleston. I went to Duke. They sent me to a heart specialist. They said maybe it comes from your heart. Go to a heart specialist. Nothing wrong with me. And I have every test in the hospital. I mean, I was in the hospital for 9 days. Every test over here in Little River and in Grand Strand. I'm healthy like a horse.
That's so weird.
And nobody could figure out what I had.
And you're from North Myrtle Beach, right?
Yeah, I'm from right here.
Isn't it crazy that the solution was here all along, huh?
Yeah.
I've had you on my mind because
Yeah,
I wonder how he's doing.
I can feel it now.
You can feel that, and you couldn't before.
No.
Are you surprised? Are you surprised it's working?
Yeah, I am surprised.
After trying everything else,
I
I'm
never
sure.
thought this would happen.
You know, if there's anybody who is kind of skeptical or thinking about trying it out here, would you recommend it?
Oh, I
or
would recommend it, yeah.
You would recommend
Yes,
it? Okay.
yes.
So we are back with Dr. Weber. How are you?
Good, thank you. How are you, Rainey?
Good. You know, we just finished talking with Mr. Horst, and he was telling us about the great improvements he's been
He is
seeing.
such an angel. We enjoy having him
It's so
come in.
exciting.
When he first came in, as on all of our neuropathy patients, we did a baseline exam. When we go to start any kind of program, like you go to start a weight loss program, what's the first thing you do? You step on the scale
Right.
to see where you are.
Horrible part.
So that you'll know where you're getting to, up
Right.
or down, right?
Right.
So with our patients that can't feel their feet, we have a test that we do because we will be able to see improvement before he can see it. And he's feeling what he calls 40% improvement, which, you know, by the math, by the test that we do, is significantly more than that.
Right.
But my numbers don't matter.
Right.
You know, only his numbers matter. So
Sure.
he's doing great.
That's
He's doing great.
exciting. So another great success story for AIM Acupuncture and Integrative Medicine. So many good things coming out of that place. Thanks for watching Living Local. We'll see you next time.